Hello, my name is Itzel. Thank you for joining Young Wisdom's third podcast titled COVID-19. Our podcast team consists of all age adolescents and communities. Today, we will discuss how COVID-19 impacts adolescents, especially in our minority communities. Questions will be answered from leaders in the medical and education fields. Contrary to early pandemic research, children are just as likely to become infected as adults. Therefore, we want to share some statistical information. COVID-19 infection rates for ages 15 to 17 were as high as in adults 18 to 49. There have been 4.8 million cases of COVID-19 in children since April 2020. An average of 341 pediatric patients were admitted to hospitals every day during the week ending September 12, 2021, and many had no pre-existing conditions. The pandemic has also impacted children's mental, social, and academic growth, especially in the Hispanic and Black community.
The Miracle of Morning by Amanda Gorman. I thought I'd awaken to a world in mourning, heavy clouds crowding, a society storming. But there's something different on this golden morning, something magical in the sunlight, wide and warming. I see a dad with a stroller taking a jog. Across the street, a bright-eyed girl chases her dog. A grandma on a porch fingers her rosaries. She grins as her young neighbor brings her groceries. While we might feel small, separate, and all alone, our people have never been more closely tethered. The question isn't if we can weather this unknown, but how we will weather this unknown together. So on this meaningful morn, we mourn and we mend. Like light, we can't be broken, even when we bend.
As one, we will defeat both despair and disease. We stand with healthcare heroes and all employees, with families, libraries, waiters, schools, and artists, businesses, restaurants, and hospitals hit hardest. We ignite not in the light, but in lack of thereof. For it is in loss that we truly learn to love. In this chaos, we will discover clarity. In suffering, we must find solidarity. For it is our grief that gives us our gratitude, shows us how to find hope if we ever lose it. So ensure that this ache wasn't endured in vain. Do not ignore the pain. Give it purpose. Use it. Read children's books. Dance alone to DJ music. Know that this distance will make our hearts grow fonder. From these waves of woes, our world will emerge stronger. We'll observe how the burdens braved by humankind are also the moments that makes us humans kind. Let each morning find us courageous and brought closer, heeding the light before the fight is over. When this ends, we'll smile sweetly, finally seeing in testing times we became the best of beings.
My name is Darylyn, and we will now present to you a skit. Our skit is titled Back to School Concerns and Excitement During COVID. The skit is about our young wisdom children and teens having a conversation about being excited and having fears about being in school during the COVID era. Each student will discuss how they feel about another year with the do's and don'ts, the wills and won'ts, as well as following what their friends are doing and not doing. Peer pressure. We hope you enjoy our original skit.
Hey, Young Wisdom, we need to talk. I'm normally excited about being back in school after summer break. I get to see my friends. I haven't seen them all summer. But because of COVID-19, I also have some concerns.
I'm a little scared. I wonder if being in school will get me sick.
I think it's best that we talk with our parents about our fears and concerns. We should let them help us through the situation, especially since the rules vary on what we should or shouldn't do because of COVID.
You are right. I hear that wearing a mask is not being required in some schools. Some teams in my school have had the vaccine, and some have not. Also, what about all the adults working in the schools? Are they vaccinated?
I even wonder if the teachers are making sure that we stay safe. What should they be doing? What should they be doing to keep us safe?
Well, I decided that I'm going to wear my mask because whether you have had the shot or not, people can still get sick when they encounter someone with COVID, and you don't know who's had the vaccine anyway.
I'm wearing my mask now, but a lot of my friends are not wearing one. I don't want to look silly, but I guess I better talk to my parents and let them help me through this concern.
I'm wearing my mask too.
I have been hanging with my friends during lunch period and after school. I know that wearing a mask is important, but my friends and I have taken the shot. I am very comfortable around them, but do I still need to wear my mask?
That's a good question. Something else we need to talk to an adult about. So many rules.
And what we do during restroom breaks, lunch break, and other passing between classes, it's just too much to remember.
I understand what you are saying, but you'll have teachers at school that should help you with some of those questions, but still talk with your parents.
Me personally, I'm wearing my mask indoors, outdoors, and on the bus. I will keep hand sanitizer, wipes, and lotion in my backpack or purse. I'm just not taking any chances.
That's a good idea. I've been packing an extra mask. It's always better to be safe than sorry. Young Wisdom, we have a lot of questions and concerns.
So true. We have guests coming on our podcast to talk about COVID-19. I think we should listen to our guests. I'm sure that we can get a lot of information that'll help us.
I agree. The guests will come on soon. They're in the education and medical fields. Since we have already discussed some of our concerns and fears, let's jot down the questions we want to ask. That'll be a good start. So, what's question number 1? Great, we have all our questions. Hey, Young Wisdom, our guest is here. Let's ask them our questions. Hello, my name is Jeremy. Our Young Wisdom guest for our COVID-19 question and answer segment will be a medical doctor and an educator. Before we begin to ask our questions, I will read their bios. Dr. Tasha Shamlin is a native of Baton Rouge, Louisiana. She is a graduate of Louisiana State University with a Bachelor of Microbiology in 1994. She then attended Baylor College of Medicine in 1994 through 1998 and completed her medical residency there as well from 1998 to 2002. She is dual board certified in internal medicine and pediatrics and has been in practice for over 17 years. In 2007, she served as Chief of Pediatrics at Baton Rouge General Hospital and was named Top 40 Under 40 in Baton Rouge. She has been named multiple times as Top 100 Doctors in Louisiana since 2007. She is co-owner with her sister of both the Medical Spa of Baton Rouge and Louisiana Internal Medicine and Pediatric Associates. Dr. Shamlin believes in treating the whole being, physical, mental, and spiritual, from outer to inner. Her greatest accomplishment is being a child of God. Dr. Stephanie Scroggins is a wife, mother of 2, grandmother of 1, and a lifelong educator. She is an administrator in higher education but at the end of the day, her enjoyment comes from imparting knowledge to students. Stephanie Scroggins has worked in higher education for 18 years, and 16 of those years have been at the community college. She has held the role of professor, coordinator, department chair, and faculty association president. The focus of her career to date has been developing educational programs, teaching, and providing leadership to faculty and staff at the community college. Young Wisdom hopes you enjoy listening to our question and answer segment of our program about COVID-19. Hello and welcome, Dr. Tasha Shamlin and Dr. Stephanie Scroggins. Young Wisdom wants to thank you for agreeing to be a part of our third episode. The subject is about COVID-19. We have questions and concerns regarding COVID. So, our Young Wisdom members will take turns asking you questions that relate to your expertise. We look forward to hearing your answers. Again, Young Wisdom thanks you and appreciates you for joining our podcast.
Hi, Dr. Shamlin. My name is Rodney. I have a question. What is COVID-19?
COVID-19 is a virus that's family. It is a coronavirus. Coronaviruses have been around for years. Typically, coronaviruses cause the common cold, but this virus is a little different from the normal coronavirus. We find that this virus can cause respiratory infection, both upper, meaning it infects the sinuses, the nose, the mouth, the throat, as well as lower respiratory infection, which can involve the lungs and the windpipe. So a little different.
Also, how long will it take for us to wear a mask, if you don't mind me asking?
Meaning how much longer do we have that we need to wear masks?
Yes.
That question is going to completely depend on the number of Americans who get vaccinated. So I personally feel that until we get children vaccinated, 5 years and older, I think we're going to be wearing masks for a while. And not just that, but we have to get more of the American population vaccinated. Otherwise, we continue to see new mutations and this pandemic continues.
Thank you.
You're welcome.
Dr. Scroggins, should I wear a mask in recess or in the restroom? I just need to know.
Should you wear what at recess or in the restroom?
Should I wear my mask? Should I wear my mask at recess or in the restroom?
Okay, so I'm going to talk about this from an educator's perspective because my disclaimer, I'm not a medical doctor, okay? But as far as in the restroom, I wear my mask in any inside closed places. So I would recommend that as well. And again, if you're outside at recess, if you're playing in a group, a closed group with people, I would recommend wearing your mask as well. And now Dr. Shamlin can speak to that more as far as the outside. I'm sure, some people say when you're outside, it's fine. But just for my personal self and what I would recommend, I have a grandson. And so when he's outside and he's in a group of children, I recommend him wearing his mask. And in any indoor space, I recommend the children wearing their mask. And again, my disclaimer, I'm not a medical doctor, but from an educator perspective, as far as trying to help and keep everyone safe, I would recommend that.
Yes, if I can comment on that. Do you mind if I comment on that?
Yes.
So you do need to wear a mask when you're in enclosed areas, including bathrooms and restrooms. And this is why. The virus lives on water droplets, which come from the respiratory tract. So let's say someone goes in the bathroom, puts their mask back up and goes out. Let's say they cough in the bathroom. Okay. That means that those particles are in the air. We know that the virus can live on water droplets for hours. So if you go in there and take your mask down and you inhale those droplets, what are you going to end up being exposed to? It's COVID virus.
COVID-19.
So the answer to that is 150% yes.
Thank you for that. Thank you for your answer.
You're welcome.
Hello, Dr. Shamlin. My name is Philip Whitehurst. I have a question for you today. How does the COVID virus spread?
So we know that it is it's spread by person-to-person contact So either by touch, so say that person coughed in their hand and they have germs on their hand, virus, once again, water droplets that have the virus. So if they touch a surface like a doorknob and you touch it and you touch your face, it can spread. So it's spread by contact, but so you can spread it through inanimate objects, but you can also spread it. It's also in the air, as I said. So if you cough or sneeze and someone coughs and sneezes on you, it can enter through your eyes, your nose, or your mouth. So it's in water droplets. The virus lives on those droplets. So if you can breathe it in behind someone that's cough or sneeze in the area where you are, or if they cough and sneeze directly on you, your portals of entry, which, as I said, the eyes, mouth, and nose. So
I have another question for you, Dr. Shamlin.
Yes.
Please tell us the best ways to protect ourselves from COVID.
The best way to protect yourself from COVID is the vaccine. So it's to get vaccinated, because it not just protects against COVID, although it's not 100%, it protects against serious complications from COVID if you were to contract COVID. The other very, very important way to prevent getting COVID is by wearing a mask.
Thank you. Dr. Scroggins, I have a question for you. Should a teacher tell all the students at their class if they found out if a person has COVID?
Well, first of all, you want to make sure that you're protecting one's privacy, okay? And in the public schools or in any business for that matter, you have to make sure that you're following policy and procedure and regulations. So again, you want to make sure that you're protecting others' privacy. So no, the teacher should not say to all of the students that a particular student has COVID in the classroom, but continue to take those necessary safety precautions to help all students to stay safe.
Thank you.
Oh, Dr. Shamlin, this is Rodney again. I want to ask you, have youth who taken the vaccine became seriously sick?
I'm sorry, ask that again. Has any youth or anyone?
Any youth, like young people, yes.
Okay, so we know there are probably at this point about 7 million youth that have been vaccinated, or at least gotten one of the first dose of vaccines in their arm. And we know that of those 7 million, only several hundred have had what we consider one of the more serious complications, but even then, very, very few deaths from it. Myocarditis, which is inflammation of the heart muscle. They have not died from it. Typically, when that happens, you'll see some EKG changes, you'll see some chest pain, some shortness of breath, but it's self-limited and it goes away. But as far as anyone becoming seriously ill, that's very, very rare. With 7 million youth incidents, unlikely. And then on top of that, you're more likely to get serious illness from COVID than you are to get the vaccine and have a serious complication. So definitely the benefits outweigh the risk.
It was first reported that youth were not getting COVID. So are most youth getting COVID-19 at school?
That it's easier for young kids and children, which we did not see in the beginning of the pandemic, to get this virus. Most COVID-19 is spread through community spread, meaning you're getting it from other people who have it. That can be anywhere from home, school, anybody who might potentially have it. The truth of the matter is younger patients typically are asymptomatic. So it's easier to spread COVID unknowingly among young people. So I'm not going to necessarily say they're getting it more from school because we honestly don't know. No, there's a large percentage of patients who have it asymptomatically, don't know it, and are spreading to people who are immunocompromised and elderly patients.
Thank you for your answer. Okay, this question is for Dr. Scroggins. A lot of schools are not requiring masks, but what should educators be doing to make sure that the students are practicing social distance in the classroom?
Well, really, we all have a lot of opinions about that, and I have my personal opinion too. But the schools are bound by the rules that are put out by the schools. So sometimes we think that the teachers should be doing more, but there's only so much that they can do as well. So if you're in a school district that says there's no mask requirement, you can't require someone to put a mask on. So as far as the schools, it's going to kind of be your own personal, thoughts as far as the way you feel about the virus. So let's say that you have a teacher and your teacher really, tried to do everything to practice to keep students safe, to practice social distancing in the classroom, then that teacher is going to do that. But again, you are bound by the rules of that institution or that school district that you work for. So we can try to do some things on our own, but again, there's only so much that we can do. And I know that there's a lot of things that are going on around us and in the school district, at the school board meetings, parents that have different opinions on things. But again, you can't blame the teachers in the classrooms for any of it, because they have rules that they have to follow and people that they have to answer to. So that question could be, it just depends on who that teacher is possibly. And again, we have to follow rules and we all need to work. So we have to go by what those rules are of that institution or that ISD that we work for.
Thank you for your answers.
Are you talking to me or Dr. Scroggins?
Dr. Shamlin, yes.
Me?
Yes.
Okay. So you said that at first youth were not getting COVID. I feel that several things. I feel that the new variant, the Delta variant, is more contagious, more infectious. So the reason why we were not seeing it in youth and children as much is because the virus was not as easy to get and not as severe disease causing. With the new variants we're seeing due to people not being vaccinated and the virus itself having the ability to mutate.
So Dr. Shamlin, there's so much false information about the vaccine. How safe is someone who gets the vaccine?
The vaccine is very safe. As we said, we've had 7 million youth that have been vaccinated, only several hundred more serious complications reported, and even more adults have been vaccinated. And if you look at the percentage of serious complications, it's even lower because a number of adults that have been vaccinated. Once again, the benefits of getting the vaccine outweighs the risk. In most circumstances, you should be referred to your physician to ask that question. But the average youth or teen, the benefits outweigh the risk of getting vaccinated.
Thank you. I have another question for you, Dr. Shamlin. If there are side effects from the vaccine, what are the side effects and are any of them long-term?
Okay, so the most common side effects, especially for youth and teens, I'm going to specifically talk to them, are no different than the ones we see for adults. So typically soreness at the site of the vaccine given in the arm, which usually lasts 48, 72 hours, sometimes can last longer, but no more than 4 or 5 days. Mild flu type symptoms, you can have chills, body aches, you can sometimes run low grade temp. So you can also see that, just like you can see with adults. The myocarditis has been reported in younger patients, but some of the more serious side effects we've seen in adults, we have not really seen in children or youth.
Okay, thank you for your answer.
Very, very safe and very, very effective.
Good to know. My next question is for Dr. Scroggins. If a teacher tests positive for COVID-19 but doesn't have any symptoms, can they still work?
And again, I'm going to ask Dr. Shamlin to kind of respond to some of that. So let me just tell you about my workplace and my work setting. And it is an educational institution. So if a teacher tests positive, they are asked to quarantine for 10 to 14 days, okay? And so then they would have to report a negative test result before they can come back to the workplace. So if you test positive, I would hope that you would not be around people until it's safe for you to come back and do so.
Thank you for your answer.
Hi, my name is Jada. Dr. Shamlin, we hear that COVID-19, the flu, and the common cold have similar symptoms. What is the difference between COVID-19, the flu, and the common cold?
Okay. So as physicians, when we look, and I talked a little bit about this earlier, when we look at respiratory infection, we divide respiratory infection between upper and lower infection. Upper infections only affect the nose, the mouth, and the throat. The common cold causes an upper respiratory infections. There are no complications from the common cold. These are very superficial upper infections, okay? The flu, on the other hand, can cause upper and lower infections. So it can cause sore throat, it can cause congestion, sinus congestion, headache, upper and the head. But the flu can also infect the windpipe and can infect the lungs. However, not as commonly. COVID-19, on the other hand, it's one of those viruses that are very different. You can have a range of symptoms from being asymptomatic, meaning you're asymptomatically spreading the virus, which is a concern, and you should be quarantined for at least 10 to 14 days, as Dr. Scroggins was saying, but can cause only upper infection, sore throat, head congestion, but can also cause lower, many instances will cause lower infection, which is windpipe, lungs, which is the viral pneumonia or the pneumonia caused by a virus. The other thing is COVID-19 is what we call more virulent, meaning it is easier to catch, it is more contagious. And then the severity of the symptoms you get from COVID-19, it's varying, as I said, but you can have significant severe illness, which can lead to death. With the flu, you can see that, but not like you see with COVID-19. That is the biggest difference. This is not the flu. And that's what we try to stress to people. That's why you must wear a mask. We have seen the number of flu cases because we are wearing masks. But with COVID-19, even wearing a mask, you can get it if you're not wearing an N95. So this is a much more virulent, much more significant disease-causing virus than the flu or the common cold.
Thank you.
You're welcome. Okay, so I refer patients to the hospital with COVID-19 in several circumstances. If they have problems breathing, difficulty breathing, then they should go to the hospital. If they're short of breath, have difficulty breathing, if they have an oximeter, which you can buy over the counter and their oxygen levels are low, 92% or lower, I refer them to the hospital. They will need oxygen therapy and maybe lung support. And then the third thing is a lot of patients, people forget it is a virus and you can get vomiting and diarrhea and significant dehydration. So if I talk to the patient, I feel like from a clinical standpoint, the patient's dehydrated, I will also send them to the emergency room for IV fluids, IV hydration.
Thank you.
For Dr. Scroggins, what should an educator do if a student in the classroom experiences symptoms?
What's the question? What should an educator do if a student is experiencing symptoms?
And you're unsure if it's the cold, flu, or COVID.
So if they're experiencing symptoms and if you're at school and you have a nursing facility or a clinic facility, that student should be sent there immediately for that person to make the assessment. And then once that person makes the assessment or get in contact with the parents, whatever their protocol is, to find out exactly what's going on with that student. But I would definitely send that student out for some other type of assessment with the medical facility at the school.
Okay, well, hi, Dr. Shamlin and Dr. Scroggins. My name is Darylyn. My first two questions are for Dr. Shamlin. Is it safe for people with certain diseases to get vaccinated? For example, people with cancer or diabetes?
It is very safe for them to get vaccinated. If anything, those are your highest risk patients to get vaccinated. They need to get vaccinated because they're the highest risk to have significant severe illness, which increases risk of death. So actually diabetes is an immunosuppressive condition, meaning when you have diabetes, your immune system is not able to fight infection efficiently or effectively. Same thing with patients who have cancer. Those are actually the patients who are considered in the high risk category, according to the CDC, getting the vaccine.
Thank you. My next question is for Dr. Shamlin again. What puts people at higher risk of catching COVID besides their underlying health conditions?
So that's an interesting question, because what puts people at higher risk other than their underlying health conditions? Underlying health conditions are number 1 through 10 on risk factors for getting COVID. However, there are some people who are in high risk occupations, meaning they are around a higher than normal number of people who might have COVID. So, for example, a healthcare worker is extremely high risk for getting COVID because they're exposed to so many different people with COVID. People who work in the schools, Dr. Scroggins, that's one reason she's on here. Teachers, they're exposed to, depending on how many kids are in the class, 10, 15, 20, 30 potential people with COVID. And then other, people who work in institutions, prisons, nursing homes, things like that. Pregnancy is considered a medical condition, but pregnant women are at higher risk, and they're at higher risk to develop complications, believe it or not, from COVID. So those are kind of the things I think about the most when I think about, other than underlying health conditions, what makes you higher risk. It's being around physicians, who might potentially have COVID, which is why, once again, according to the CDC, certain occupations are recommended to be vaccinated. And there is a list on the www.cdc.gov website.
Thank you.
You're welcome.
My last question is for Dr. Scroggins. When educators were doing virtual teaching, what were some of the challenges for teachers and students?
Some of the challenges is just being disciplined to be able to, do what it is that you need to do. And when you're not right there in the midst of what your normal routine is when you are in the school system, it's kind of hard to be disciplined. And then also the socialization aspect of it. You're not able to be around your peers and do the things that you typically do. And so that's challenging. And so just coming back into the schools, that's still difficult for the students to get back into those normal routines. And so discipline is the biggest challenge for students when they are doing the online classes.
Thank you.
I did hear the question, but it looks like the question was being repeated. Can you hear me?
We can hear you.
Okay, so I always think about 4 major classes that I think of medications that people are concerned about. Truthfully, things like ibuprofen, Tylenol, those are not contraindications, and there's no negative impact with getting the vaccine. People always ask, well, I'm on antibiotics. Can I take the vaccine? Yes, you can. As long as you're not having symptoms from the condition that you're being treated for with that antiviral or that antibiotic to get the vaccine. It has nothing to do with the medication you're taking. Some people are on blood thinners, and I'm not talking about aspirin or ibuprofen, but prescription blood thinners. And those patients, is not a contraindication, but we know because we're giving a vaccine in the muscle, sometimes there's a risk of bleeding. And so the only thing is the person giving the vaccine needs to know that, so they can watch for signs and symptoms of bleeding, which we always make people wait 30 minutes after they get the vaccine. We actually observe them. So once again, safety first. And then the last group, which there's no contraindication per se, but we recommend a patient consults with their physician, people who are on steroids and people who are on what we call biologics. And I'll kind of explain each. Steroids suppress our immune response. Some patients are on it they get it for joint injections or spine injections. They're on it for their immune system problems or their chemo. Sometimes when you're on the steroid and you get the vaccine, because it's suppressing your immune response, it's going to suppress your immune response to be able to make antibodies to the vaccine. So your vaccine is not as effective, which is what spurred the whole let's get the booster in. Because we know those patients who are chronic steroids or chronic medications like that, their immune response is not as good. And when we tested their antibodies, it showed they didn't have any antibodies to the vaccine. So that's why we recommended the booster first and foremost for those patients before any other group got approved. So steroids, you don't have to get off of steroids to get this. If you have a choice and the steroids are optional, you can put off a joint injection or something like that. If you can wait 2 weeks before, and 2 weeks after getting steroids, your vaccine will be more effective. Same thing with immunologics. For example, medications for Crohn's disease, which is an inflammatory autoimmune condition of the gastrointestinal tract, or lupus or other autoimmune diseases, and there are medications to suppress their natural immune response. We just have to make sure those patients know if we can schedule the vaccine around their injection or infusion, we try to do that. Or if they have to have it, they have to have it. So there's no contraindication, but just realize your response won't be as good to the vaccine.
This is another question. It's for Dr. Shamlin, yes. Is it safe to stop taking medication prescribed or over the counter?
You should never stop taking any medication prescribed by your doctor without consulting with your doctor. So you should never just stop any medication, even for the vaccine, without talking with your doctor. I know, where everybody's really computer tech savvy now. So I will always get an email asking, do I need to stop any of my medications? It's always better to ask. No question is a stupid question when it comes to your health and communicating with your physician. So a lot of times it's just sending an email. Okay. And then as far as over-the-counter medications typically are optional medications. They do not have to be stopped. Once again, consulting with your physician is important, but typically there's no reason to stop any medications that you take just to get the COVID vaccine.
Thank you. This question is for Dr. Scroggins. There's an increase of suicide in children and youth since the pandemic. As an educator, how can you help our generation?
Personally, what I would say is just allowing them to have a voice and to talk about the things that are going on and the things that they're thinking. We don't allow that conversation enough. And just like now with the pandemic and the students coming back into the classroom, we can't be so busy trying to just push the curriculum and the things that we think that the students should be learning, but allow them some time out, some space to think and to talk about this and kind of meet them where they are, because they do have questions. And a lot of it is scary for people. It's scary for adults. But again, allow them to have a voice, allow them to voice their opinions on what they're thinking about this pandemic, what they're thinking about what's going on in life in general. Just having those moments to just talk, just plain old talking is good. And encourage that. Encourage them to have those talks with their friends. Encourage them to have talks with their families, but allow them to talk and listen. And when I say listen, not listen with a closed ear, but really listen and listen for those things that may be some signs of things that you might need to share with someone, or share with a family member, but just allowing them to have a voice to share what they're thinking.
Thank you for your answers.
Thank you.
Hi, I'm Journey. My first question is for Dr. Shamlin. Can people who have taken the vaccine still spread COVID-19? And if so, what can someone do to not spread the virus?
So the answer to that is yes. People who've had the vaccine can spread the virus asymptomatically. And studies show, we thought at first being vaccinated, you actually have a lower viral load, meaning you're shedding less virus, but studies have shown that's not true. You can shed the same amount of virus as someone who has never been vaccinated. So the best way to stop spread is, once again, even though we have all of these governors lifting, but it can happen, and it does happen. However, your chance and risk of that is much lower, which is why we still recommend getting vaccinated, is to wear a mask when you are in heavily public places, heavily populated, even outside. Dr. Scroggins was talking about this earlier, as well as wearing masks inside. So just because the governor says you don't have to wear a mask is not a reason to not wear a mask. I don't know if I'm making sense or not. So you will not spread if you're wearing a mask. You're less likely to spread. And get vaccinated, because you're less likely to get the virus and then transmit. The problem is we have younger kids between the ages of 5 and 11 right now who are not vaccinated, which hopefully we'll know something by the 2nd on whether the CDC approves a recommendation by the FDA to get those kids vaccinated.
Okay, thank you. I have another question for you, Dr. Shamlin. Why are people still getting hospitalized even though they have taken the vaccine?
The reason they're still getting hospitalized, although it's not as common, is because the vaccine is not 100%. It's not 100 proof. It's not 100% preventing from getting the virus. And so there's some people who have underlying medical conditions who, even though they're vaccinated, they're breakthrough cases and they're still getting sick enough to go to.
Thank you for your answer. My last question is for Dr. Scroggins. So, since students just started going back to the classroom, have you noticed if anyone's experiencing like any changes in their social and educational skills? And if so, what are some of the changes?
Actually, students are happy to be back into the classrooms, into the schools. So you do see progress there because they are happy to be back socializing with their friends and that type of thing. So you see behaviors that have changed because they are happy to be back around their peers. Now, let me speak to you just from the college setting. So from the college setting, what I'm seeing with the students, they are congregating more, like, outdoors, and there are little spaces where they have for them to sit and that type of thing. And even in the buildings where they call sticky spaces, you see them, they're meeting with their friends, but they're taking precautions as well. You're seeing them wearing their masks, you're seeing them social distancing. So they are actually thinking about what's going on and what's happening in the world around us in the space that we're in. But you do see people that are more happier because they're glad to be back in the schools and around their peers. And that's a good thing because we need to try and get back to some type of normalcy. Of course, we know that it won't ever be like it's been, but again, it helps them being back around their peers.
Thank you.
Thank you.
Dr. Tasha Shamlin and Dr. Stephanie Scroggins, is there anything that you would like to discuss before we conclude?
There's nothing that I would like to discuss, but I would like to say thank you all so much for the opportunity to visit with you. You had some really great questions, and I just wish you the best and much success on what you're doing. And thank you for having me.
I just wanted to say thank you for having me. I always like any platform to educate people, especially young people. I will say that recently they did a poll or a survey, and at least 75% or more Americans know somebody who had COVID and died from COVID. And I'm going to use this as my time to say I lost both of my parents to COVID within 2 weeks of each other. And that was April, May last year. So I don't take it lightly. I think it's important to educate people. It's important people know the virus is still out there. Our governors are lifting mask mandates. There's a new variant, the Delta Plus, which I hope is not Delta on steroids out there. We're still trying to learn a lot about that new variant out. And this is not going away, that even though we're striving for normalcy, we'll never be 100% back to where we were. But when you take a vaccine, you take it not just for you, but you're protecting your loved ones, as those who can't protect themselves because they're either older, elderly, as my parents, or they have multiple health conditions, which increase their risk of getting significant severe disease and therefore increased risk of death. So just realize when you take it, you're not just taking it for yourself, you're taking it for your loved one, your grandmother, your aunt, your mother, and your community. So be proactive and get vaccinated. Thank you for having me.
Of course. Our Young Wisdom team has had a lot of questions and concerns in reference to COVID. And we just wanted to thank you guys for answering our questions, and your answers have helped us and everyone who will tune into our podcast. So thank you for sharing your wisdom.
Thank you.
Thank you.
So that concludes our question for our guest panel. We have now reached the end of our podcast. Remember, the COVID-19 virus has had a huge impact on all of our lives. It's very likely that we've all known someone who's contracted the virus. Today, we've had the opportunity to hear from educators and doctors, and we are so grateful for their time. We hope our discussion has helped our listeners to better understand COVID-19 and learn how we can all play our part to put an end to the pandemic. Thank you for tuning in to Youth Wisdom's third podcast. Don't forget, wash your hands, wear your mask, and continue social distancing. Stay safe, everyone.